today we are doing a presentation on our partnership with Care Guide Advocates. I know last time we had one of the bills on here, and he gave us a great overview of what Care Guide does and who they are. However, this time we're going to kind of go over medical debt as a whole and introduce Empowering America and Care Guide together, and kind of the whole process when it comes to using Empowering America for these specific services. One thing I did want to share with you guys is a personal story and how we are very passionate on a whole nother level when it comes to providing these kinds of services. Each one of us has our own, unique story for each different service of why it was amazing. And for me, Care Guide is very pertinent because medical debt is huge. When my daughter was 17 years old, she had to have an emergency appendectomy. And I'll never forgive myself. I made her go to school that morning. I thought she was just, crying wolf, and she ended up needing to get her appendix out. So fast forward, they literally did not end up billing her until after she had turned 18. She was like 17 and a half, something like that. And she had insurance, okay? And it was good. We had very good insurance at the time. They ended up sending her like a $20,000 bill. So here's my daughter, 18 years old, and she's already $20,000 in medical debt. Okay. Not to mention, if she's going to go to college and, there's other debts that are involved as, we grow. So right out the gate, my child personally was affected. Okay. And, I'm sure we all have our own stories, but it kind of just goes to show that even just becoming an adult where you are just financially responsible for yourself, you're already in debt, right? And obviously, with the price of care and things like that, Care Guide has a lot of other services that they're able to offer, which is why I'm also going to be putting my daughter through this program. So I just wanted to share that with you guys really quick, just to kind of paint the picture of who we are and how passionate we are about these services, before the lovely Aja goes ahead and presents this for us. Now, Aja has been with Empowering America for quite some time. You guys may have never even seen her because she usually stays in the back and does cool stuff for us, and, does debt calls. However, she is growing and the company is growing, and she is very passionate about this service as well. And so she was a perfect person to go ahead and present for you guys today. So without further ado, I would like to introduce Aja Rosehill, and she will be taking it from here.
Thank you, Destiny. Good morning, everyone. My name's Aja, and thank you for joining us today as we delve into this topic that affects us all: healthcare costs and medical debt. Healthcare costs and medical bills have become a significant source of stress for many households. How many of you guys have experienced the burden of medical bills? You guys can either raise your hand, put a 1 in the chat. Yeah, me too. And what about if you've been surprised by the amount of the medical bill at least once? Every time. So we all know that healthcare costs can be super overwhelming. Medical bills can quickly add up, leaving individuals and families struggling to make ends meet. Which is why this partnership today with Care Guide Advocates and their mission, helping millions save billions on healthcare, is really important. Now, how many million Americans have some sort of medical debt? What would you guys guess?
at least 50%.
And I think her name
Okay, good
30
guesses.
million.
30, all right. It's actually 100 million Americans have some sort of medical debt, excuse me. And around, let's guess again, how many million Americans had medical debt collections on their credit reports affecting their ability to secure loans or housing?
20 million.
Oops. Ariana? It's actually about, yeah, it's actually about 42.9 million.
Oh, wow.
Wow.
is she doing?
What was that, Angelina?
I said, wow. I didn't know it
Yeah,
that
wow
much.
is right. Yeah. And about 57% of American adults have been surprised by a medical bill that they thought would have been covered by insurance. So these are all really staggering statistics, but very real. So medical debt is actually responsible for 66.5% of all bankruptcies in the United States, and around 32% of adults in the United States reported having medical problems paying their medical bills or having problems paying them. So, all right, so let's get into Care Guide Advocates' mission, which is helping millions save billions on healthcare. Care Guide Advocates is a leading advocate in helping individuals and families navigate the complex world of medical billing and debt. It was initially founded by both a medical doctor and a healthcare attorney, which is what makes their company so special. They also have no apps, no logins, so it's very human-centric, and you're able to reach a real-life, world-class Care Guide advocate to have them tell you where to go for affordable care, or take on the fight of high-cost medical bills. So our experienced advocates over there are by your side as they utilize our proprietary technology and price transparency tools, which we'll get into right now. So one of their tools is a hospital bill eraser. So they're able to map out financial assistance programs of about 5,000 hospitals across the United States. The hospital bill eraser it allows the CGA team to direct you to an affordable hospital before you even get hit with a surprise medical bill. A lot of people are not aware of this, but over 100 million Americans are qualified for free or reduced medical care. So the hospital bill eraser also helps those unexpected out-of-network and emergency bills. And they use proprietary analytical processes as well as financial assistance programs to match them, and sometimes even eliminate or reduce the error-filled hospital bills. A lot of people aren't aware, but hospital bills and medical errors are responsible for, I think it's $539 million in healthcare costs each week. Let's see. So I'm just going to take a couple minutes to show this video. It gives more details about their program.
Oh, Asia, we can't hear it.
You can't hear it?
You're probably going to have to reshare.
Okay.
There's a little checkbox when you reshare, and it'll say share using audio.
Sorry, guys. Share sound. There we go. Share. Okay. Is it good now?
100 million Americans are entitled to free or discounted hospital care, and you might be one of them. Nonprofit hospitals are required to give free care, yet they skirt their obligation to do so. Let Hospital Bill Eraser take on the burden of dealing with a hospital bill for you. The free care zone is in the blue part of this chart. It's based on household income and family size. That's free care or a smaller bill waiting to be had at thousands of hospitals. Many hospitals have a sliding scale discount for care, up to double the dollar amount shown. Hospital Bill Eraser can quickly begin to erase a hospital bill. We have indexed the financial assistance phone numbers, applications, and policies for each hospital. The details of a financial assistance policy are available to assure the best outcome for our members. Hospital Bill Eraser also can be used proactively for elective care via our free care map. For example, by knowing a pregnant woman's household income and number of family members, Hospital Bill Eraser can quickly determine which hospitals can provide her a free or low-cost delivery of her baby. The application to erase the bill can be completed, ready, and waiting. Our advocates use our Hospital Bill Eraser negotiation wizard to combat the many wrongful billing practices that abuse you financially. We take advantage of 20 different opportunities and use them against the hospital to fight on your behalf. Kick back, relax, let us take on the hospital for you. Hospital Bill Eraser is here to help you take on nonprofit hospitals and make them honor and fulfill their nonprofit obligations to better serve their communities by erasing your medical bill.
Okay, so that was the Hospital Bill Eraser. Now, this is just a picture of their Hospital Bill Eraser charity map. The Affordable Care Act requires nonprofit hospitals to conduct an assessment of the health needs of people in the communities they serve and take those steps forward in addressing those needs. It's actually covered in all 50 states. And again, there are over 5,000 hospitals nationwide. So our CGA experts will assess our clients' medical bills and financial situation. Most of the time, they're able to reduce the debt by half or even eliminate hospital bills for the most vulnerable clients with step-by-step guidance through the entire process. Now, these are just a couple of real client testimonials. CGA has successfully saved countless individuals and families thousands of dollars. As you can see, the first client saved over $70,000. I survived the heart attack, but the bill nearly killed me. The second saved over $300,000, as well as the CGA advocate was able to help the member with pre-approved treatment 100% free moving forward. So that's really great. Okay. Now, in America, we have two types of people historically. There are those who have, one, received a medical bill, and two, those who are going to get surprised by a medical bill. So this is just a quick little tale of two patients. It'll be another short little video, so.
Meet Bud. Bud loves pickleball. So does his friend Cash. Bud's game is slowing down a bit due to some pain in his hip. The same with Cash. Bud's primary care physician ordered an MRI. Cash's did too. Bud made his appointment at a big hospital's imaging center. Cash called Care Guide Advocates and located a less expensive alternative at a smaller imaging center. Bud paid $1,500 out of pocket. Cash paid just $600 out of pocket and saved over $900. Bud hates to lose, in pickleball or in life. So Bud called Care Guide Advocates, who were able to lower his bill by $500. Now, Bud and Cash are back on the courts with new hips, new energy, and new ways to save money in healthcare. Care Guide Advocates, helping millions save billions on healthcare.
I'm with Bud. I really hate to lose too, which is why CGA has changed the game with their third option. They really do provide a helping hand to protect clients both before and after their care to ensure they're finding the most affordable prices. So, all right. So this is just our initial journey for our clients as they enter their journey through medical debt or getting their medical debt taken care of. So our initial intake over here at MPowering America consists of questions designed to gather pertinent information about their current medical bills, their financial situation, and specific challenges they're facing. So their debt must be at least $7,500, and When the claim occurred, they won't qualify if they had Medicare or Medicaid. So our initial intake aims to capture details such as the nature of the medical procedures, outstanding bills, insurance coverage, and any existing disputes. And then from there, we'll go ahead and schedule their intake with a CGA advocate. And based on the information provided, CGA's experts will evaluate, CGA's expert or evaluate the client's situation to determine their best course of action. They're going to be able to match them with different programs using negotiation opportunities, as well as the potential for bill reduction. Medical billing errors are a substantial issue in the United States. I'm sorry, guys, can't speak this morning. And it's costed, I think, the healthcare system an estimated $935 million weekly, as well as, 80% of medical bills have errors due to 25% of these mistakes are due to typos. So Care Guide Advocates goes through the itemized bills with a fine-tooth comb. They're able to rectify the errors and get the bills reduced. Now, after MPowering America completes the initial transfer, CGA will send out the welcome email as well as complete the welcome call. They'll have a unique case ID and case portal where the client is able to upload documents as well as their itemized bills. And CGA will also cover the charges that are going to be charged the first month. From there, the intake completes any other qualification questions, confirms the documents that they've received, and then an advocate is then assigned to their case and they take over. So it's a really hands-free process, at least for our agents. Once you guys get them over to us, we'll do their initial intake and then get that information and connect our clients with the CGA advocates. Okay. So again, CGA is able to reduce the debt by 50%. Their pricing structure equates to 50% of the total debt. So when the clients call in, ideally, if they can have an accurate estimate of their total debt, that way we can give them a more accurate estimate as we calculate their advocacy fee. So this ensures a fair and reasonable approach to alleviate their financial burden. And another great thing is that they can make payments in equal monthly payments. So let's see. The payments are spread evenly over a defined period of time for ease of budgeting and flexibility. CGA set up the terms so that they're on a 24-month term or 36 months. And all billing is streamlined through CGA, which simplifies the payment process. And again, MPowering America's partnership with CGA focuses on a balanced financial outlook. It's more of a holistic approach. That way we can alleviate their stress and financial strain, and ideally putting our clients in the best position possible so that they're not feeling that added burden anymore. So let's see, these are just some of the great services that are offered to you through CGA, negotiating care costs, DME price reductions. Clients have lower or eliminated prescription costs. Again, they have their hospital bill eraser, their money map, and pricing portal. So we're going to go ahead and watch just a couple of the money map and pricing portal tools on these next couple of slides. But clients will have access to a team of experts who will negotiate on their behalf with health insurance providers and insurers. So they are in really great hands over there. So this is just another short video of the money map. They're able to use proprietary data-driven mapping tools to find and confirm low-cost providers by zip code. And this is applicable for some of the most common routine care, such as blood work, imaging, and outpatient surgery.
Health insurance companies make purchasing healthcare confusing. If you think that going to any provider in-network saves you money, think again. They have wildly different pricing for the exact same care. If a health insurance company owned a gas station network, some members would pay $6 a gallon of gas, while others would pay $60 per gallon of gas. That's your health plan. With MoneyMap, pricing variation is eliminated and care is affordable. MoneyMap is a low-cost locator that helps our advocates provide affordable access to care. MoneyMap saves on in-network care an average $150 per blood draw, $700 per imaging study, $2,000 per GI scope and other surgery center care, and $2,000 by using an urgent care and going home instead of an ER. There are many non-hospital in-network medical facilities. This is where savings occurs. With MoneyMap, our world-class advocates can help you know to go here, get care, save money. MoneyMap. Call us to get the care you need while saving money on healthcare.
So that was their money map. Now we're going to go over their pricing portal. This is great as they're going to be able to know specific care costs before even stepping into the door. They're going to make sure our members and clients are not the next victims of this broken billing process in the medical industry today. They use proprietary medical code databases with actual pricing across the country for 16,000 healthcare services and procedures.
The price a health insurance company pays for care has been a tightly held secret until now. Pricing Portal allows our advocates to give you the real price for care that insurance companies don't want you to see. We've opened the vault on tightly held information by using over 1 billion real medical claims. And now you get the benefits. Our expert advocates leverage the price for care so that you never overpay. Pricing Portal is the best tool for our advocates to get the lowest price for care and negotiate hospital bills.
So that was their pricing portal. Now, again, just to recap, the top 5 reasons to call CGA or enroll your clients with Empowering America so we can connect them to CGA. So 1, they don't want to get a surprise medical bill. 2, they don't understand their medical bill. 3, you can't afford your medical bill. 4, hospital harassment and being threatened with being sent over to collections. And 5, you want someone to take over and fight the hospital bill to a final resolution. I love how James puts it. They focus on the prices, or they focus on the codes and the prices. What did you say, James? It was like, we fight the right side while they fight the left side when you're looking at a medical bill. Something like that.
Yep.
Something clever like that. Yeah.
That's right. They, you know,
Yeah.
all the pricing stuff is on the right side, all the codes are on the left. So the customer's always focused on the right, which is the stuff that they get stuck paying for, unfortunately. Us, our team, our advocates focus on the left to make sure that the stuff on the left actually lines up and is in alignment with the treatment they received.
Thank you.
Most people reading the medical bill wouldn't have a clue what they're talking about and all the terms and that are used within the medical world. Haven't got a clue. There's
Absolutely. You're so right. And there's like 70,000 codes. And you know, we haven't really even touched on the fact that for really potentially, you know, life-threatening and expensive ailments like cancer, CGA actually has specialists in those fields that deal with only those codes. So depending on the illness, we can be assured that our clients are going to be getting the highest level of care and attention from the advocates at CGA for sure.
great. Now, one question I do have is the cost savings strictly for the medical facility and the hospital? And does it also work with the doctor cost? Because sometimes they separate doctor's cost from hospital facility cost and everything that was done in there does Care Guide do both?
That is such a great question, Rex. And yes, absolutely. Care Guide doesn't care if it's coming from the hospital holistically, or, so like you mentioned, sometimes the hospital has the doctors as like subcontractors, or, you might have bills from the ambulance service, the anesthesiologist, labor and delivery. You might have your gynecologist have a separate charge, etc. So it doesn't matter where the charge comes from. If it's medical related, medical code related, CGA is here to help.
Well, now, if you've got an existing doctor that you've got a really good relationship, you probably don't want to tell him you're going to be going to Care Guide, because he's going to be she's going to be very upset that their bill may be deal. So how do you handle that issue?
I would probably leave some of the discussion for a Care Guide to help our clients navigate. But for me personally, I would be concerned about where I'm giving my loyalty. I mean, if my doctor and my hospital or whatever who's supposed to be giving me care is not being attentive to my bill, how much loyalty do I really owe them? So I guess, like, for me, it's up to it's up to everybody individually. Some people might have a really deep, close personal relationship with their doctor, and they don't want to spoil that. That would be a decision that they would have to make when they see, what the impact would be. But for me personally, I would question my loyalty to somebody who is not being loyal in return.
Okay, I got it.
Great questions. Thank you, Rex. Always great questions.
I have a question.
Okay.
What do you got, Angie?
Okay, she mentioned about Medicare medical patients, or it's not covered. So if they only have Medicare, the PPO, not the HMO, can they utilize this program? Because Medicare, if you only have Medicare, straight Medicare, that's a PPO. Medicare Advantage is the HMO.
Yes. Unfortunately, if they're covered, at the time of service, the service was covered by Medicare, Medicaid, Care Guide can't get involved.
Nothing with Medicaid or Medi-Cal here in California. If you're Medi, of course, the whole, your medical bills will be paid on both sides, right? So it's the copay is zero. But for someone that has Medicare only, which, the Medicare only pay 80% of the healthcare costs, they don't have Medi-Cal or Medicaid, they can utilize this or no?
No, because Medicare and Medicaid already has checks and balances in place to ensure that they're being billed correctly, and that if there's free care, they're already getting the free care. So Care Guide is able to eliminate bills by billing errors. But because it's already government related, they already have their own checks and balances to ensure they're not being overbilled. So even if they're only being billed 20%, there's nothing that CGA would be able to conceptually do.
So this is only for private HMO or PPOs, right?
Or uninsured, but yes, that's correct.
Okay, uninsured. Okay, well, that's a good. I'm kind of familiar with this kind of program because I used to sell. We call it this discounted program in healthcare, and our clients only pay like $79 a month for the whole family. It doesn't matter if there's 8 people in the household. But of course, Obamacare killed it, and I mean all the doctors, hospitals, everybody in the healthcare system, they belong to a discounted program, but patients doesn't know that.
Right.
It's still being charged with the regular rates.
Yep.
And this is really good. This program that will help them a lot. So, yeah.
Yeah, we believe so. Great questions. Absolutely.
Yeah. Well, thank you.
Now, a Medicare, actually, the situation is if you take A only, that only covers the hospital. Until you take B, then that covers the doctor.
The doctors.
And then you cover C, and that covers the prescriptions. So in a lot of cases, even if they're on Medicare, they're still totally vulnerable to the doctors and lots of other expenses that may not be covered by the A category.
That's a great point, Rex. And I don't know the answer to whether or not Care Guide can help people who have Medicare, but the specific service is not covered. We will yeah, Rex, it's D and
Yeah,
C, not C. What are you talking about, Rex? Anyways, we will get with Care Guide to get that question specifically answered so we can get the information to everybody on this meeting.
With Medicare, if it's only straight Medicare, it's only 80%. That's why we recommend our clients to get the supplemental. And they pay the 20%. So it's still, they don't pay anything.
Yeah, in that case, I know that CGA is not going to be able to help them. But in the case where like they have Medicare services that cover hospital, for instance, but not other services, I'm not sure if CGA can cover those services since technically there's no coverage on those services. But we will get an answer to that.
There's a very unique secret that most people are not aware of. Doctors will often overkill on all the procedures that they do because they're trying to prevent themselves from being sued for not taking full measures. And so there's a lot of unnecessary treatments done within the medical world.
I believe that. All right, awesome. What other questions y'all got for us?
Well, I love the way you did this today. It's really great. Thank you very, very much.
Thank you.
Absolutely. All right, awesome. So we appreciate that. Like I mentioned in the chat, we will have this up with any luck today, if not Monday at the latest on our YouTube, and we will email the link to everybody, whether they attended or not, so that they can watch it. Coming up here in the next couple weeks, next week, actually for the next 3 weeks, we are going to be wrapping up our social media marketing series with Evelyn. Week 1 we did last week. That is already up on our YouTube channel, so feel free to check that out if you folks have not already seen it or are interested. And then we will get into week 2 next week, Friday, same time, same station here, 10 o'clock in the morning. There should be, if you're not already registered, there will be emails going out next week with the registration links. But on that note, Destiny, any final words for us? Asia, any final words for us?
Yes. Asia, would you like to, is there any final words before I give our next presentations that are coming?
No, but I appreciate you all for joining us today. And if you guys have any questions, don't hesitate to reach out to us. And happy Friday. That's all.
Hey, thank you, Asia. So we also have the social media with Evelyn that'll be coming up next Friday. We did move it because we thought it was really important that we got this in here and kind of get you guys a little more acclimated to the CGA process with us because it is going to be huge. This is definitely something that is going to help a lot of people. So again, if you are interested in going ahead and joining us next week, please register. The emails have already went out. If you didn't see it, give us a call or shoot us an email at contact@empoweringAmerica.com and we'll get it over to you. And then is there anything else? No, I think that's it. Thank you all so much for joining us today, and we look forward to seeing you next week.